Hello, and thank you for tuning in to our Facebook Live Q&A about COVID-19. I'm joined once again by UI Hospitals and Clinics hospital epidemiologist Jorge Salinas, who will give us an update on the state of the pandemic and answer questions about precautions, the holidays, and more. Please submit any questions or concerns you have now, and we'll answer as many as we can throughout our discussion. Thanks for joining us today, Dr. Salinas.
Glad to be here.
COVID-19 cases and hospitalizations are increasing again in Iowa and in much of the U.S. Can you explain to our audience what's happening and what this means for public health?
Yes, Iowa and the entire Midwest is in a very problematic position currently. We have more than 600 Iowans hospitalized, and just yesterday, more than 2,000 Iowans were diagnosed with COVID. The trends are very problematic, are very worrisome. It's very likely that hospitals will be overwhelmed pretty soon by this wave of cases in Iowa. And unfortunately, it's affecting our neighboring states. So they may not be able to help us because we're all going to be in the same situation. So yes, the situation in Iowa is critical. It's critical. We have to change the way we're doing things, or otherwise we're going to continue suffering the consequences.
Yeah, and for a while it seemed like maybe smaller parts of Iowa may not be hit as hard because they were more rural. Is that still the case? And if it's not, how does that affect like the bigger hospitals like ours?
Correct. Yes, COVID has taken its time to reach our rural communities, but it has made it. It is there. And it makes things much harder because when there is community transmission, all age groups are affected. Older individuals are affected. They need hospitalizations. Also, it makes it harder. If you want to go visit your family, you can get infected. In the past, the recommendations that remain true were to avoid getting together with other families or going to large gatherings, bars, or weddings. Now it is your own family can give it to you because the incidence is too high at the moment.
Thanks for that explanation. So I'm interested in your reaction to the increase in numbers. How do you feel about this as an expert on infectious diseases?
I am very sad. I'm very sad to see what's happening. At this moment in the pandemic, several months in, we know what works to prevent it. And this is not a partisan issue. But unfortunately, we've had difficulties in implementing these common sense public health measures. Masks, hand hygiene, physical distancing, avoiding crowds. We should all know how to implement those things and go about our lives with some normality. But the more we ignore those simple steps, the less normal our life will be. We're gonna lose our grandparents, our parents. I'm not being fatalistic. It's a reality, and the worst is yet to come. As the holidays approach, as winter settles in, we're going to have to be closer together in indoor spaces. The risk will just go up. So it's never too late to implement these things. I remain hopeful that Iowans will wake up. This is not a political issue. Vote for whoever you want to vote. It doesn't matter, but implement these simple science-based recommendations and your life will be better. Your family will remain complete.
Yeah, that actually touches on another question I wanted to ask you, which is, everyone seems burnt out. People who haven't been taking precautions, as well as those who have been strictly taking precautions. It's 7 months of this. We're over it. What would you like to tell our audience about the importance of continuing to stay safe? If you have anything else besides for what you were just mentioning.
Yes, I totally understand. We knew that COVID would take longer to reach rural states, rural communities. And many of them were asked to hunker down very early on when perhaps the risk of COVID wasn't as high. So if and they've been doing it very well probably for months, and it's normal to get tired. Unfortunately, the virus doesn't mind how tired we are, and now is here, is present. Iowa is experiencing the highest levels of transmission in the epidemic so far, and the Midwest is leading the country in the rate of transmission happening. So even though we are tired, we understand. I am part of the same. You're part of the same. We're all tired of this, but this is a time in a race where even though you're tired, you just push a bit harder, because otherwise we're going to continue suffering the consequences. Again, 600 people are hospitalized. Many of them require intensive care, mechanical ventilation. Many of them don't make it. Um, so please continue taking care of yourself. There are still safe ways to socialize. Wear a mask. Again, you can advertise for your candidate of choice. It doesn't matter. Again, masks are not political. Masks work. Please wear a mask. Please wear a mask. If you're going to socialize, try to do it in small groups. Unfortunately, the levels of transmission in Iowa have made large gatherings of more than 10 people very risky. So try to limit your socialization to very small groups, to your close family members or neighbors. Create small bubbles and try to stick to those.
Yeah, that's a great reminder. I know my mom just did a little Halloween gathering for her grandkids, but we did it outside. We did it socially distanced. No one gave hugs. So it felt a little weird, you know. It wasn't a typical gathering with grandparents, but we did it. And it was so much fun because we're so starved for that interaction and to be with the ones we love. So there's definitely ways, like you mentioned, to do it safely, wear masks, social distance, have hand hygiene ready and available. It's doable, and it feels really good to do it when you can do it safely.
I think so. I would highlight again the great things that you did outdoors. Fantastic. Wearing masks helps tremendously. And if you limit the number of people, chances are that you will be safe. You can still socialize in small groups where everybody wearing a mask. And especially if you do it outdoors, you get a thumbs up.
That feels like such good news hearing you say, like, you can still have a little bit of your life. You just got to do it safely.
Correct. Correct. But the more corners we cut, the more transmission we'll have, and then it becomes less and less safe.
Yep.
So I think that what you're doing is what we should do, and that if all Iowans did what you just did, the incidents would go down.
Well, that's right on topic, because Halloween is in 2 days. I think people still want to celebrate the holiday in some way. So I was just curious, what are you planning to do with your kids, if you don't mind sharing with us? And what advice would you give other people who still want to enjoy Halloween?
I think Halloween can still be celebrated safely, especially trick or treating, for the reasons that we just mentioned. It's outdoors. Children do very well with masks. They kind of like them. So children do well with face coverings. So absolutely, outdoors, face coverings. Try to limit the amount of candy you go and get. That's good advice, anyways. But if you visit a few houses in your neighborhood, I think it's going to be reasonable. It's an acceptable risk, if you will. What is not safe is to have large gatherings, large parties indoors. That is very problematic. I have some statistics that I pulled for Johnson County and let's say Scott County in Iowa. A gathering of 10 people in Johnson County has a 13% probability of having a person with COVID in it. In Scott County, a gathering of 10 people has a 26% probability of having a person with COVID in it. A gathering of 50 people, which is going to a bar or a big party, has a 50% probability of having a person with COVID in Johnson County, and a 77% probability of having a person with COVID in Scott County.
Wow.
And those are not, again, those are counties that not necessarily have the highest incidence. If you do this in Dubuque, if you do the math for Dubuque, for example, a gathering of 50 people has a 99% probability of having a person with COVID in it. So again, the advice has to be tailored based on the incidence, but most of Iowa is having high levels of transmission currently. So that's why I would not advise anyone to socialize in any groups of 50 people. And I would say 10 is probably the threshold. Less than 10 people, if everybody has a mask, if you do it outdoors, you can continue doing it. Otherwise, you saw the statistics, your risk just goes up and up.
Yeah, well, thank you. I live in Scott County, so those statistics are just startling to me, and I think they should be startling to everyone in Iowa, and it really kind of makes it real. So thank you for sharing that with us. So since we're on the topic of holidays, I feel like it's the $1 million question right now. Can we celebrate the holidays? We've got some questions from Facebook, so I'll just start with the first one we got. Maggie asks, are there ways to make an indoor family gathering less risky? We would be limiting our gathering to 10 people.
So that's good. So limiting the number of people, wearing a mask. If you can tolerate it, opening the windows, improving ventilation can help. And especially if these are close family members, they're part of your bubble, it would be acceptable. But again, we have to keep an eye on the incidence, on the trends. The more transmission we have, the less likely it will be that we will be able to meet safely in Thanksgiving. So there's still some time. We can bring the numbers down if we follow these simple recommendations and have a quasi-normal Thanksgiving. If we just let it go as kind of we have, Thanksgiving is going to be very, very problematic. Thanksgiving, Christmas are going to be very problematic.
Thanksgiving is my favorite holiday, so I need Iowans to save the holiday, okay? Everybody keep wearing your masks.
Yes, we can do this. Iowans are very smart. I trust them to follow these simple pieces of advice.
Great. Jody asks, holidays with 3 question marks. Can we get together with extended family this year, or should we be safe and skip this trip this year? So I think she's asking about traveling really to a family gathering.
So it again depends on any state in the Midwest is currently experiencing the same peak of transmission. So if this is going to be a large family gathering, it's problematic. If you're going to go visit your parents or grandparents, there is a probability that you're going to bring COVID to them. So I would advise limiting travel at this moment within the Midwest, or visiting extended family within the Midwest at this point. But again, the good news, try to give things a positive spin. We can change things from now until Thanksgiving, but we have to do our homework. We need to do these little things, bring the numbers down, and then we will be able to have a relatively normal Thanksgiving. If we don't do the homework, the final exam is going to come and we're not going to be able to pass that test.
That's a great analogy. That's going to stick with me, and I hope other people take it and share it with others as we all talk about the holidays coming up. If you're just joining us, we're here with Dr. Jorge Salinas, hospital epidemiologist here at UI Hospitals and Clinics, talking about COVID-19. Please comment with any questions or concerns you have, and we'll answer as many as we can in the time remaining in the discussion. So I want to kind of pivot a little bit to vaccines. A vaccine for COVID-19 will hopefully be available in the next 6 months. Fingers crossed. Whenever the vaccine is available, do you plan on getting it?
Absolutely. Vaccines undergo tremendous scrutiny. Vaccines have to be safe and effective before they get an approval from our federal agencies. So if a vaccine successfully passes these rigorous trials and is proven to work and to be safe, I'll be first in line to get it. Absolutely. It's the same. You know of another vaccine that has undergone all that evaluation and is safe and effective is the influenza vaccine. And that's something that Iowans can do right now. You don't have to wait 6 months. You can do it right now. That's one of the things that you can do to help alleviate the pressure in our healthcare system. So by avoiding getting flu, so the vaccine against the flu works in several ways. It prevents you from getting the flu, but if you are unlucky and you do get the flu, it's going to be a milder case of influenza. Bottom line, you won't need hospitalization, intensive care, etc. So that is good for you, is good for our healthcare system as well. Go get a flu vaccine.
Yeah, and kind of on that same topic, you and I were actually just discussing a research that shows that mask wearing, if we have close to universal mask wearing, respiratory illnesses in general can be decreased by around 40%. So really, mask wearing applies not just to COVID, but flu season as well, right?
I love it. Yes, we can win two battles at one. We can beat COVID, we can beat influenza at the same time. If you just follow these same recommendations, the recommendations we're giving of distancing, masks, hand hygiene, avoiding large crowds, work against all respiratory viruses. So we could, rather than losing to some degree, rather than having these increasing cases, we can, by our actions, by our behavior, we can make both of these diseases go down this winter.
Great, thank you. We have, it looks like we got a message from someone on Facebook that's having a little trouble hearing you. So if you don't mind just speaking up a little bit, but we also have a bunch of other questions from Facebook. So I'm gonna start asking you some of those. Jody asks, if a family member tests positive, does everyone in the household need to self-isolate? And does everyone in the household need to get tested?
Yes.
Yes to both? So play it safe, everyone get the test, and everyone self-isolate for the time that, I mean, I've gotten tested because I've been exposed, and they're pretty good about giving those guidelines, right? When you get tested up, here's how long you should isolate for.
Yes, your county public health agency will get in contact with you. But yes, the general guidance is that anyone that lives with a person that has laboratory confirmed COVID should be in quarantine for 14 days and should be tested.
Great. Brandy says her daughter tested positive but did not have a fever. How long in cases like that are you considered contagious, or do we even know?
So if a person doesn't have symptoms but tests positive, the advice is to isolate for 10 days. After that, they can return to work, to school, etc.
Great. Shannon says she's due to have a baby in 6 weeks. Very exciting. Congratulations, Shannon. She's wondering what extra precautions she should be following right now.
Hi, Shannon. I would recommend to stay home if you can. That's what our OB doctors are recommending nowadays in the last few weeks of pregnancy, to stay at home, to try not to socialize with others. It increases the chances that everything will go as good as we want it to go. So yes, decrease socialization, stick to your household. That would be my best advice, and good luck with everything, Shannon.
Yeah, so Jody is asking about those numbers you were giving us earlier with the risks for gatherings of 10 and 50 people. Do you happen to have information for Dubuque, or is that something we could maybe comment later with?
Yes, we can comment on it, but I do recall that the probability of encountering a person with COVID in a gathering of 50 people in Dubuque is 99%. So bottom line is that in Dubuque County, if you go to a bar, you must know that there is a person with COVID right there. And in other counties, now bars oftentimes don't have 50 people. If they have 100 people, in all of Iowa, 100 people, the probability that one of them has COVID is nearly 100%. So that's why I'm giving numbers, but that translates into our recommendations. You should not be in groups of 50 people. In my advice to you would be to not be in groups larger than 10 people. And I would only be in groups of 10 people that are my close family members that wear masks and, if possible, outdoors. Now, going to a bar, for example, combines all these things. They are not part of your household. It's an indoor place. It's crowded. Sometimes they don't wear masks. Is Chances are that you're going to encounter COVID if you go to a venue like that.
Great. Thank you for that reminder. Diane asks, should a 90-year-old parent be invited over for the holidays when she'd only be around 3 family members? So it sounds like very small gathering, but I mean, an elderly parent is in a higher risk group. What are your thoughts on that?
I think it's a very difficult call. What you have going for such a small gathering is the number of people. The smaller the group, the lower the possibility that one of them is carrying COVID without symptoms. So if the gathering is truly 4 people, if everybody is very mindful of their interactions, they wear masks consistently all the time, and if they are able to maintain certain distance, if possible, do it outdoors or opening the windows, it may be okay. These are all personal decisions. Again, and my advice I have tried to be consistent in meeting people in the middle, rather than being like, no way. The 90-year-old person has to leave. They want to see their family, and we want them to be able to do so. So if you take all these recommendations, very small groups, everybody with a mask, especially if possible in a large, spacious location, I'll say okay.
Thanks for those reminders. I feel like we can't hit on them enough right now to just keep reminding people that there's lots of layers of protections we can take. Lori on Facebook asks, how likely is it that we can get COVID-19 twice? Do we know?
This is an interesting and tricky question. In the short term, it's unlikely. People have immunity against COVID for a few months. There are some rare cases that we have seen in the literature that has been published in scientific papers of people getting infected more than once. But the rule, that's the exception rather than the rule. The rule is that you get COVID, you probably won't have COVID again for a few weeks or months. In the long run, after 6 months, after a year, my analysis is that yes, humans will be susceptible to get COVID more than once as years go by. That's why a vaccine can be so effective.
Yeah. So it feels like every one of us knows at least someone who thinks that face coverings and other safety precautions are not all that important. Have you had conversations with anyone like this throughout the pandemic? And if so, what do you think is the most effective way to help people understand what's at stake?
Yes, I understand this is a difficult subject. What I would say is perhaps, what do you have to lose? And we have proven in some of the videos that we've provided that your oxygen levels don't go down, your CO2 levels don't go up. There is hundreds of publications that show directly or indirectly how masks do work. But again, if not everyone can take the time to read all that scientific literature, but listen to all these public health experts. I don't have a dog in this fight. I don't care, if you vote for one group or the other group. I'm giving you my advice as a doctor. I want Iowans to be healthy, and I do believe that masks work based on everything that I've read. All the places that use masks as part of a comprehensive strategy are able to bring the number of cases down. So I would say, please just give it a shot. You'll see that it's not as hard as it may sound, and you're not gonna be any less strong because you're wearing a mask. A mask is just a mask. And now there are some very cool masks, bandanas. There are many things that you can use to decrease your chances of giving COVID to others. What you need to remember is that COVID, you can have COVID and not feel it, or you can have COVID and you will feel it in a few days in the future. So we should all work under the assumption that we carry COVID, and that's why we try to pre- be civil and prevent passing it to others by having a mask that traps those little droplets and aerosols that we all produce when we speak, breathe, and talk.
Yeah, so you just touched on something that someone asked about on Facebook. Jody was asking about eating with others. So at restaurants or at a family gathering, if you wear a face mask until you go to eat and drink, is that still safe? Because then you're still taking off your face mask at a certain point.
Correct. No, I agree. The risk goes up. That's why sitting down to have a meal with somebody else that is from outside of your household is risky. The more people in that gathering, the riskier it is. So if you're going to do it, my advice would be to not do it, to limit your gathering to your family, to your close bubble. If you're gonna do it outdoors, and try to have a lot of space in between you and those other people.
That's great. Great advice. So a lot has changed at our hospital in the past 7 months, just like a lot has changed in our country. We have a screening process. We have visitor restrictions. Can you explain to our audience how we're keeping them safe when they need to come get care at our hospital?
Yes, we continue reviewing science, modifying our protocols. Our number one priority is keeping our patients, visitors, workers safe. We require face coverings for all of them, and we continue doing screening for employees, for visitors, and again, everybody wears a face covering here at UIHC. We are maximizing our efforts to decrease the chance of people acquiring COVID here in the hospital. But it's important to remember that no place is entirely safe until we're able to bring the incidence of COVID down. Our numbers, the number of new cases detected. If we have 2,000, 3,000 positive cases every day in Iowa, there is not going to be a single place that is entirely safe. Your own household won't be safe. So we have to all follow these simple recommendations to bring the incidence down.
So in the current state of things, where we are seeing numbers go up in Iowa, parents who have kids in school are getting, if they're not already a little worried, they're starting to feel a little worried. What does the data say about risks in schools, and what factors do you think parents should consider when deciding to keep their kids in the hybrid model or in person?
I agree. It is unfortunate. As I said, if the incidence continues going up, there's not going to be any activity that is entirely safe. There's some good news. Science is starting to show that children younger than 10 or so are less likely to spread COVID than older children and adults. Uh, so that's relatively good news. But we need to have a societal approach. We cannot pretend that it's okay to go to bars and these large gatherings, but we're going to have to close schools. And we should prioritize education. Schools should be the last things to close. And we should try to mitigate the risk of transmission in those other venues. So for parents of young children, my advice would be to keep an eye on the incidence of COVID, the numbers, the positivity rate in your county, and know that younger children are less likely to spread disease. So I would say that if they all wear masks, if the number of people in your school is somewhat limited, it may be okay for them to continue going to school.
Great, thank you for that. So we're all out of time, and I just wanted to reiterate the different things that people can do to continue staying safe. We've really talked about masks a lot in this last half hour, but there's more things than that. And like we already talked about, when you layer all those precautions on top of each other, you're really well protected. Could you just re-explain for our audience, what are the things they can do every day to try to stay safe?
I think all Iowans by now know masks need to be used. We need to maintain our distance from others, wash our hands. But I want to sprinkle this with number 4, avoid large crowds, especially indoors. Those are associated with super spreader events. It is not surprising. We've seen it time and time again. People go into a bar, 50 come out of that gathering infected. And then some of them may be very young and nothing too bad happens to them. But unfortunately, every person with COVID, on average, infects another person. So you can infect your parents, your grandparents, your children. So be very careful. We're in a very, very pointy, very tricky situation here in Iowa. This is our time to take extra precautions so we can save the holidays.
Well, thank you so much for your expertise and all of your advice today, Dr. Salinas.
Thank you.
And thank you for everyone who tuned in. If you joined us after we started, make sure to go back to the beginning of the broadcast to hear all of the great information that Dr. Salinas provided us today. And stay tuned to our social media accounts and our website, uihc.org, for all the latest updates on COVID-19 and tips for staying safe as we move forward. Lastly, please remember to wear a mask, avoid enclosed spaces whenever possible, and take good care of yourself and your loved ones. Thanks for watching.